Snakebite. Snakebite is a life-threatening medical emergency. So in this video, we will see about what is snakebite, its clinical features, pathophysiology and management. So the statistics shows that in world more than 400,000 snake bites occur each year. That is around 5% of mortality rate. So in India, 216 species of snakes are there, and in that 52 species are poisonous. So the estimated death of in India due to snake bite are around 50,000 people per year. So the population at risk are around 50 million. So if we see the incidence of snake bite in India, around 50% of bites are dry bites. So dry bites means snake bite happens because of the non-poisonous snakes. Male female ratio, if you see male or more than the female, that is 2:1. Children between 1 and 9 years of age are the most likely victim. The majority of the bites are in lower extremities, you all know that. Incidence is more common in monsoon season, at night, or in the dim light areas. It's commonly reported snake bites or in the following states: Uttar Pradesh, Andhra Pradesh, Bihar, West Bengal, Maharashtra and Tamil Nadu. It's good that Kerala is not in the top list, but of course Kerala is also a place where there are a lot of snake bites happens. The very common venomous snakes in India. So this is one of the university asked question, that they asked the students to list down 4 venomous snakes. So if we see the venomous snakes in India, it is of coming under 3 categories, like Elapidae family, Viperidae family and Hydrophidae family. So the examples of Elapidae are cobra and krait, and these are neurotoxic. And Viperidae, all the vipers comes under Viperidae family. That is the very common vipers in India is Russell's viper, saw-scaled viper and pit viper. So these are hematotoxic. And next one is Hydrophidae, that is sea snake. These sea snakes are myotoxic. So how we can diagnose the poisonous snake bites? So the snake bites will show fang marks. So I have given in my first slide of the introduction snake bite, you can see the red dots. So that is called fang marks. They are classic 2 puncture site with a distance of 8 mm or more. It depends upon the snake. Okay, so fang marks are the identification of a snake bite. But how will you identify a poisonous snake? It is with the help of the head, belly, scales, body design and pupil. So that's why most of the places they say if you have seen the snake, you have to bring it so that we can identify exactly what kind of snake it is. So this is a slide which shows the difference between poisonous and non-poisonous snakes. Poisonous snakes will have a triangle head shaped, and whereas non-poisonous snake will have a round headed head. An elliptical pupil is identified in poisonous snakes, and the non-poisonous snakes will have a round pupil. And fangs are present in poisonous, whereas there is no fangs in the non-poisonous. And if you see the anal plate, there will be a single row in poisonous, whereas in non-poisonous snake the anal plates are double row. Okay, the rattlesnake will have a rattle at the end like this. If we see the pictures, these are all the commonest snake in India. That is krait, cobra, pit viper and Russell viper. So what is snake venom? Snake venom is a combination of enzymatic and non-enzymatic polypeptides. So it is acidic in nature, and the specific gravity is 1.03 to 1.07. It is water soluble. So remember this, because snake venom is water soluble. If you wash it nicely, the wound, with soap and water itself, some of the poison will go. Lethal dose is cobra is 0.12 gram and krait is 0.06 and viper is 0.15 gram. So the krait is more dangerous because even as 0.06 gram of dose will be a lethal dose. The effects of envenomation. So the effects of envenomation is happens in different way. We have, when we discussed about the type of snakes itself, I have said it in the tabular column, that neurotoxic, cardiotoxic and myotoxic. So neurotoxic, hemotoxic and myotoxic. So it gives two types of effects. The envenomation happens with two types of effects, that is local effects and systematic effects. So local effects, it's from the place where it is bitten. The snake where it bite, that area will show the local effects, and the systemic effects is caused by the type of the snake. It can be neurotoxic, hemotoxic, cardiotoxic and myotoxic. So the local effects, generally the fang marks will be visible and severe burning pain will be there, infiltration and discoloration, and sometimes serosanguinous discharge comes out of the site. So what are the neurotoxic effects? Neurotoxic effects is given by elapid, that is common krait and cobra. So the pre-paralytic stage shows emesis, that is vomiting, headache and loss of consciousness. So this is a very, very classic sign that the poison is in the brain, because vomiting, headache and loss of consciousness happens. So in the paralytic state, patient will show some kinds of paralysis, that is ptosis, that is the closing of the eyelid, ophthalmoplegia, they cannot open the eyes, dysarthria, difficulty in speaking, dysphagia, difficulty in swallowing, convulsion and respiratory failure. So these are all the common effects, neurological effects of the elapid bites. So the next one is cardiotoxicity happens with cobra. So cardiac depression, cardiogenic shock and cardiac arrest happens in the cobra. So you have to monitor the patient, not only the respiratory status but also the cardiac status. So like heart rate, blood pressure and the signs of cardiac arrest should be monitored. The next is viper bites. Viper will have a different kind of local effects, that is, along with the swelling and discoloration, a blister will be formed in the viper bites, and bleeding will happen because the vipers are hemotoxic. Severe pain will be there. So pain is more, and bleeding and blister formation happens in the viper bite. It shows, this Viperidae family shows hemotoxic effect, that is bleeding happens. So usually we check the patients for all kind of bleeding tests, like bleeding time, clotting time, PT, APTT, D dimer, all these things we check in patients with viper bites. So hemotoxic effects like bleeding gums, epistaxis, hemoptysis, that is vomiting the blood, hematuria, blood in the urine, and purpuric spots, the red spots around the body will be seen. So myotoxic effects, it means myo means muscle, so it affects the muscles, muscle pain, muscle stiffness, and this because of the muscle injury, the renal tubular necrosis also happens with the myotoxic effects. So sea snake is causing myotoxic effects. So these kind of effects will be seen if the patient is bitten by the sea snake. Investigation. These are the investigations which commonly done in patient with snake bite. Hemoglobin, usually they check their hemotoxic effect to find out. They usually go for platelet count, peripheral smear, PT, APTT, D dimer, and the urine examination. If the patient is having bleeding, so automatically RBC destructions, the urine will show proteinuria and RBCs, hemoglobinuria, all these things will be seen in patient with severe bleeding, because RBC destruction happens, so we can identify in the urine. Biochemistry, basic creatinine, urea and potassium, just to make out whether the kidney is affected or not. ECG, X-ray, CT and ultrasound is done also to find out is there any other bleeding happening inside the body. Oxygen saturation, ABG, because some of the Elapidae family, they will show respiratory failure, and ELISA is done to confirm the snake bite. And if you see the pathophysiology of snake bite, it is very simple. So the snake venom enters into the surrounding tissue where it in the bite area. So what happens? The surrounding tissue itself is affected directly by the venom action. So it will show the local effects. So slowly it will absorb in the capillary through into the blood cells and blood and lymphatics. So what happens, once it is absorbed in the blood and lymphatics, it will go to the target organs. So target organs is nothing but as per the type of the snake, the effects will be there. So if it is a viper family, Viperidae, what happens, the target is blood vessel, so it will start destructing the blood cells. And if it is a elapid family, it will go directly to the brain and it will start giving neurotoxic effects. So if it is a myotoxic, what happens, sea snake family, it will affect the renal system. So the target organs are affected, causing systemic effects. Clear? The next is management. Management is very important in snake bite because the efficient management will successfully save the life of the person. So first aid, there are a lot of confusion with the first aid in snake bite management. So here they have given a modified method of first aid. So present first aid protocol is ineffective and dangerous. So what the people are following, like tourniquet and sucking up the blood out, so all these things should not be done. The traditional methods should be avoided, and modified method of first aid is done with the help of with the step of reassurance. So you have to reassure the patient, you have to give confidence to the patient that they will be survived. That is a very, very important and psychological effects which will give a good prognosis. Immobilization. So this is the first and foremost thing you should do is immobilization. Rush to the hospital immediately. It means very closest to hospital, you have to move them. Avoid use of tourniquet. So tourniquet should be avoided. This is a very common thing everyone does in the scene of snake bite. So tourniquet should be avoided. So reassurance, immobilization, move to the hospital and don't tourniquet the wound. Pre-hospital emergency. So what you can do on the way to the hospital is immobilization. Immobilize and keep the immobilized part below the heart level, because the bloodstream should not move to the heart. Like, so you have to keep the affected part below the heart level. Manage airway breathing circulation, because some of the neurotoxic snake poison will cause respiratory failure. So patient may need to monitor ABC, as well as you need to initiate CPR. Immediately transfer the victim to the nearest hospital. The next is hospital management. So in hospital, what we will do, for patient of course has a severe burning pain, so they need analgesics. So we need to start them on paracetamol IV and tramadol 50 milligram bolus, IM or IV. NSAIDs like aspirin can be prescribed, but it depends upon the patient's status. And anti-snake venom. So what is anti-snake venom? It is an immunoglobulin derivative which is taken from the plasma of horse or sheep which has been immunized with one or more species of snakes. So the horse and the sheep, they have a immunization happening in their body when they have a snake bite. So from that plasma we take the venom, anti-snake venom. So there are two types of anti-snake venom, that is monovalent and polyvalent. So in other countries you can see monovalent anti-ASV, because it depends upon the type of the poison. Snake, they will prepare the monovalent snake venom. Whereas in India what is available is a polyvalent. It means for all kind of snake bites they will give this ASV only. So mild envenomation, we have seen the effects of local effect as well as systemic effects. So if the effects are mild, they usually use 50 ml of ASV, that is 5 vials. If the patient shows only local effects, and they brought immediately to the hospitals. Moderate envenomation, that is like mild signs of systemic effects like thrombocytopenia, platelet drops, those kind of mild bleeding. Okay, those cases they usually give 5 to 10 vials, that is 50 to 100 ml of ASV. Severe envenomation, case of severe respiratory failure or paralytic stages, those cases like more than 200 ml of ASV is needed, that is of around 25 vials. So this is how they start on the anti-snake venom. So along with the painkillers and ASV, supportive management is also essential, because in the site there is possibility of other problems. So they usually start on antibiotics, methylprednisolone, that is steroids to reduce the respiratory arrest, FFP and blood products in case if the patient is having bleeding and thrombocytopenia, that is FFP is fresh frozen plasma, prevention and treatment of hypotension. So there is possibility of hypotension in patient with snake bite. So in that cases they will start preventing and of course treat the patient for hypotension by giving fluids. So what is the post discharge plans? Once the treatment is done, the patient is survived, so you have to instruct the patient to visit the hospital when if worsening of swelling even after elevation. So you have to instruct the patient to elevate the part for few days. So in that cases, if the swelling is increasing, they have to come and report to the hospital. Abnormal bleeding, if it happens again, they have to come. Information to be given regarding serum sickness. Of course, the ASV will cause some kind of tiredness and they have to take rest. Bleeding precaution at least for 2 weeks, and regular checkup of blood indices in the follow-up checkup. So these are all the post-discharge plan you should teach the patient. Hope you understood what is snake bite, what are the types of venomous snakes, how to identify the venomous snakes, and what is the pathophysiology, clinical features. So clinical features usually depends on the type of poison, and then what is snake venom and what is anti-snake venom, what is the hospital management, pre-hospital management and post-discharge management. Thank you.